When a new patient comes in, and even for our returning patients, we want to make them feel as comfortable as possible. That starts with check-in. The first face they see is a smiling face. From there, we take them to the back. We do 5 screenings. The first screening is a risk assessment screening. The reason we do the risk assessment screening is we want to check for any medical issues, any medications, any allergies, any underlying conditions that could affect dental health or dental treatment. We also ask if there's a history of heart disease because we know that there's a connection between heart disease and oral health. And lastly, we ask if people have increased stress levels. That's because we found that increased stress levels are related to bacteria in the mouth and grinding issues. The second assessment we do is an oral cancer screening. The reason we do that is to check for any abnormal lumps and bumps, any discolorations, to make sure that there are no signs of oral cancer. The third assessment we do is an occlusal screening, and the reason we do the occlusal screening is to check the bite, check the jaw muscles, check the joints, make sure everything is functioning well. The fourth assessment we do is the restorative screening. The reason we do that screening is we want to check for any broken down dentistry, any active decay, broken fillings, things like that. We want to make sure everything is in functioning order. The fifth assessment we do is a periodontal screening. The reason we do that screening is to check the gum health. We want to check for any tartar buildup, biofilm, which is basically bacteria underneath the gums, any kind of bleeding, any pocketing, bone loss. By doing these screenings, we ensure that we're checking all of the details of the patient's oral health. We do want to make sure we're not missing anything, that we're very thorough, and that's the whole reasoning behind these 5 screenings. We have a good starting point, we know where our start is, and we know where we need to be.